what name shall I use for you?
Elizabeth.
Okay. Hi, Elizabeth.
Hi, doctor.
My name is Dr. Gurleen, and I have been looking after your baby, John. And I'm happy to inform you that John is now ready to be discharged.
Okay, that's a good news.
Yes. And before we discharge John, I wanted to have a chat with you about how you're feeling and if you have any questions about continued care at home.
Yes. So doctor, as you told me that I'm ready for discharge, so my son, but I'm trying to keep positive. But yesterday I looked at some online forums and I'm worried about my son. I mean, he still looks yellowish, and that's concerning me, honestly.
I think it's a natural response to feel this way, being a parent. But I'd like to reassure you that you did the right thing by coming to the hospital. So what is your current understanding of hyperlipidemia? That's the common word that we use for this is jaundice. That's why John was admitted to the hospital. What's your current understanding of this?
Oh, well, what I understand is that it's common in kids, in little infants or kids, and it causes yellowish of skin. I think that's all that I understand.
Yes. So this usually happens when the baby does not get optimal amount of breast milk. And it's a harmless condition, nothing that you should be alarmed about. So when the levels of bilirubins rise in the baby's body because of less intake of breast milk, that's what causes the yellowish of the eyes and the skin. But then again, like I said, it's not something you should be concerned about. John has been treated now. He's ready to be discharged. And you did your absolute best by bringing him to the hospital. And you don't have to be worried about health. Yes.
Doctor, I'd like to interrupt you. Somewhere I feel responsible for my son's condition. I mean, I'd like to know if there's something I could have done differently.
I think it's perfectly fine to feel how you feel because you want to do the best for your child. I understand why you're feeling this way, but it's very common for children to, especially infants, for infants not to get the adequate supply of breast milk when you're trying to establish breastfeeding. John is just 1 week old. It will take some time for you to establish a feeding routine. And you will find that as the number of feedings become more frequent, the bilirubin's level will also continue to reduce because they will pass through his body. So while I understand your concern and I completely respect it as well, but you did what you could, and this is a very common condition. Lots of new infants go through this. In John's case, it was very mild and it has already been treated. And what I would like you to do is just focus on increasing the frequency of feedings, and this should help take care of reducing the bilirubins over time. You will find that in the coming few weeks, John will be completely cured of this condition.
Okay, so you mean that I should continue breastfeeding and I should not start bottle feeding? Is that what you meant?
That I would advise that. However, if I could make a suggestion, I would like to set up an appointment with a lactation consultant. These are certified professionals who specialize in breastfeeding issues. How this would help you is they can first of all guide you in how to increase the frequency of feedings. And they would also help you monitor the feeding intake and pattern. If at all we feel that there is a problem, then they can help you perhaps switch to formula feeds or combine the breastfeed with formula feeds, but that's something that they can advise you on after monitoring. Would that be helpful?
Yes, I think seeing a lactation consultant would be a good idea. I also would like to know if I can take my son home now.
Absolutely, yes. You can take your son home. John's bilirubin levels are lower. He's safe to be discharged. And there's some precautionary things that I'd like you to do at home. Number one, I would like you to monitor if the yellowish discoloration increases
Okay.
If it does, then I would like you to bring John back to the hospital. Again, this is just a precaution, not suggesting that this would happen, but something that you should look out for.
Okay.
And try to feed John adequately and as frequently as you can, perhaps 8 to 12 times a day.
Okay.
Yeah, would you be able to do that?
Yeah, sure. I can do that.